What are antibodies in cervical cancer immunotherapy? Imagine your immune system as a highly trained team ready to fight off invaders. In cervical cancer, sometimes the cancer cells find ways to hide from this team. That's where antibodies come into play. These are specially designed proteins, often called monoclonal antibodies, created to recognize and target specific molecules involved in the cancer's ability to evade immune attack. They can do two main things: block the pathways that cancer uses to hide or deliver targeted attacks directly to the cancer cells. One key way antibodies help is through immune checkpoint inhibitors. Cervical cancer cells, especially those linked to human papillomavirus infection, often exploit immune checkpoints like PD-1 and PD-L1 to suppress T cell activity. Think of these checkpoints as brakes on the immune system. When cancer cells activate these brakes, immune cells become less effective at attacking. Monoclonal antibodies such as pembrolizumab and nivolumab block PD-1, while atezolizumab blocks PD-L1. By releasing these brakes, T cells can become more active and attack the cancer more effectively. Similarly, CTLA-4 inhibitors work earlier in the immune response to boost overall immune activity. Another approach involves antibody-drug conjugates, or ADCs. These are antibodies linked to chemotherapy drugs. The antibody binds specifically to a molecule on the cancer cell surface, delivering the drug directly where it's needed. This targeted delivery minimizes damage to healthy cells and can improve treatment effectiveness. Beyond checkpoint inhibitors, antibodies can also modulate the immune environment around the tumor. For example, some antibodies target molecules like CD73 or 8-WAR, which produce immunosuppressive substances. Others activate co-stimulatory molecules such as CD137 or OX40, which help T cells survive and work better. There are also antibodies that block CSF1 or CSF1R, which can reprogram immune cells called macrophages to support anti-cancer activity instead of suppressing it. These antibodies work through different mechanisms. Some block signals that turn off immune cells, allowing T cells to attack the cancer. Others deliver drugs directly to the tumor, and some change the immune environment to favor fighting the cancer. Clinical studies have shown that immune checkpoint inhibitors can help some patients with advanced cervical cancer live longer, but not everyone responds. Researchers are working to identify markers like PD-L1 levels to predict who might benefit most. Combining these antibody therapies with other treatments like chemotherapy or radiation is also being explored to improve outcomes. In summary, antibodies in cervical cancer immunotherapy are powerful tools that help the immune system recognize and destroy cancer cells. They do this by releasing immune brakes, delivering targeted drugs, or modifying immune cells to be more active. These therapies are part of a rapidly evolving field that offers hope for many patients. Always remember, these treatments are administered under medical supervision and are part of approved protocols. If you or someone you know is considering immunotherapy, it's essential to consult healthcare professionals for personalized advice and care.